Recovery after dimpleplasty. So the most important thing is to keep your mouth clean because the healing incisions are on the inside of your mouth. The sutures on the inside of your mouth will dissolve, so try not to play with those sutures with your tongue too much, because if you play with them all the time, you could undo the knots that are holding everything together. I want you to wash your mouth out with the Paradex or chlorhexidine mouth rinse that we prescribe. Wash out your mouth every time after you eat and before you go to bed to help minimize any food particles that could build up on the incision. Initially, for the first week, do your best not to eat chips or foods that create lots of particles that could get stuck in the incisions. Brush your teeth like you normally would, but make sure your toothbrush doesn't injure the healing incision on your cheeks, on the inside of your cheeks. Lastly, you can shower, swim, and do everything you normally would right away because the incisions are on the inside of your mouth. I do want you to wait a few days before you exercise or increase your blood pressure to minimize the risk of any late bleeding. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.